This is Rochelle Madison and Joanna Brooks for our giant slaloms case scenario for a seminar. And our scenario says, as a nurse in an endocrinology practice, you spend a significant amount of your nursing practice teaching and counseling patients who live with diabetes. Your next consultation involves a 37-year-old patient whose wife accompanies him to his appointment. They have been coming for counseling on a weekly basis to troubleshoot difficulties they've been encountering in dealing with his newly diagnosed insulin-dependent diabetes. The wife voices frustration over her husband's seemingly lack of concern regarding the seriousness of his illnesses. And with this, we do have a couple of questions which Joanne and I will be going through today.
Okay, the first question is, what elements should be considered in assessing the patient's learning needs? We came up with, we have to assess the person's vital signs, consider his developmental stage. When it comes to Maslow, we have to make sure that he is in a safe, loving environment, and if he has the help that is needed. We also have to make sure that he understands his disease, and that has to do with whether or not he understands about the diet, whether or not he has to get enough exercise, make sure that he's comfortable with needles, and also that he is able to understand the medical jargon in regards to his insulin-dependent diabetes.
Another thing that we took into consideration in regards to his developmental stage is that he's at the developmental stage of isolation versus intimacy, and we've come to the conclusion that he has no issues because he has a wife, so we know he's intimate and he's not isolated, so he has help with his wife, and she's also concerned. Our second question is, why is it important to demonstrate warmth, openness, and friendliness? And we talked about therapeutic communication when it comes to Hildegard, and being able, when you're warm and open, it allows a patient to communicate with you some more and verbalize their needs and wants.
By being warm and open, it opens the dialogue to collaborate with ideas. It opens the channel to give what you believe could be the right answer, while also listening to what the other person might believe is the right answer. Since the wife is concerned for her husband, she may have one way of thinking of how to deal with the issue. And since she came to us to talk about this because she's concerned for her husband, she probably tried all avenues to try to get her husband to understand. So now here we are talking about it together, the nurses, him, and the wife, so that way we all can come up with a solution, so that way the diabetes, the insulin-dependent diabetes, won't turn into a complication and her husband end up in the hospital. Okay.
Sorry, Joanne.
No, go ahead.
No, I was gonna add that our number 4 is we were gonna talk about how might motivational interviewing assist in this case, and what skills are needed for motivational interviewing?
The motivational things we have came up with is empathy, listening.
Yep.
Empowering our client so that way he can feel comfortable enough to handle his diabetes. We also came up with teaching him. One of the ways we can teach him is through demonstration. Since the wife is there, we can demonstrate how to use the needles, where to inject it. Because by being empowered, by feeling comfortable with how to take care of your illness, it gives you a way of actually doing it instead of putting it off for somebody else to do.
And one of our goals with motivational interviewing is to make sure that our clients are independent, and independence is a way of making sure that our clients are motivated and empowered to take care of themselves. Our last question is, if patient non-compliance is an issue, what could be contributing factors to his non-compliance?
One thing that could contribute to his non-compliance could be, for instance, like we talked about before, he might not be comfortable or understand his illness or disease. With diabetes, especially insulin diabetes, you have to be cautious about watching what you're eating, about making sure you're getting enough exercise. You also have to be cautious about whether or not you are contributing to your disease yourself. For instance, there's a lot of people that when it comes to their insulin, when it comes to their diabetes, they eat everything, which in turn can raise their blood glucose. And next thing you know, they need the insulin. Since his wife came in with concerns, most likely the wife probably realized that, you know, he needs a little bit of help. Since, you know, they probably was trying to figure it out on their own. So that's why we here, you know, trying to set up a meeting so that way we can get everything under control.
And even though we know that he has a wife who is concerned about his diabetes, some of the non-compliance issues are also with family members. They bring you food that you should not be eating, not in a bad way, but just because they know you want something and you eat something, they will bring it over to you. Another thing is non-compliance with diabetics is if you've never had a needle, have to take a needle every day, it's hard to start taking a needle every day. So that's another issue that we have to educate our patients, that they understand how and what the effects of diabetes are. And this gentleman is also 37 years old. He might also think about his libido when it comes to using or taking lifelong medications. Those are issues for us to consider, to be more empathetic as nurse when it comes to his, we wouldn't say non-compliance, we call it non-adherence. Right, Joanna?
Yes. What else? What also can enhance his motivation to learn is, like what we talked about, is showing through demonstration. We can break it down into layman terms, like we talking to a third grader, so that way he will, and also his wife will understand the importance of getting your diabetes under control. I don't think I can think of anything else. Can you think of anything else, Rochelle?
No, I found this to be a very helpful topic, and this was Joanna Brooks and Rochelle Mattison from Giant Slaloms. Thank you for joining us today.
Thank you.